Alright, so I'm Dr. Carmen and I work at Cosmetic and Dental Emporium. I have a practice in Bryanston, and our practice looks at how we are different to other dental practices. Is we have a holistic view. So we have a look at the patient as a whole and not just look at one problem in the mouth. And I've been here for about 3 years, 2 years permanently, and we're just having so much fun. Our group of Cosmetic and Dental Emporium, we are a family and we just have the greatest time with our patients. So I studied at University of Western Cape, and I have been working for, I can't even remember anymore. I think it's been like 7 years now. And I started working in Stellenbosch. It was a very family sort of run practice, and I learned a lot from the dentists that I worked with there, and worked with a maxillofacial surgeon in surgery, and I fell in love with orthodontics. So we did a lot of orthodontics. We do a lot of orthodontics at our practice as well, and I did my diploma in orthodontics, and we are always doing courses trying to keep up, with the latest trends. So it's totally safe. If you are going to be using something over the counter, something that's not approved by our medical boards, then no, it's not safe. If you're going to see your dentist and they are doing a proper whitening for you, it's 100% safe. We're not adding anything to the tooth, we're not taking anything away. We're just making them look better. What's important is people coming in beforehand to have that consultation. Some people are, predisposed to having severe sensitivity, okay? So it should never be painful, but we can guide you on sensitivity. So we can do things beforehand to make it as little sensitive as possible. So side effects, like we spoke about just now, sensitivity, and to certain degrees. Some people have none, some people have severe. If you do have, it would be only for 24 hours, okay? And like we said again, we're not adding anything to the tooth, we're not taking anything away, so your risks are absolutely minimal. Any porcelain work, so crown or veneer, will not whiten if we do whitening. They will stay the same color that they are. Your actual natural teeth will whiten, and we'll have a discussion beforehand as to, are we trying to get your teeth to the color of your previous veneers or crowns, or are we going to change any crown or veneer work afterwards? We actually provide you with a home whitening kit, okay? So you can do a little bit, after 6 months or a year, depending on how your teeth whiten. You can do a little bit of a touch-up. And to come in for your oral hygiene appointments once every 6 months is what's going to get you a great result. Everybody is different, so there is like a 1% chance that your teeth will not whiten. And everyone's teeth are made up differently, have different strengths, so it's difficult to say beforehand. We can give you a guide, but it's difficult to say how white they are going to be. They're not going to be veneer white, but they are going to be the whitest natural that your tooth can be. So the procedure with doing there's home whitening, there's in-chair whitening, there's a combination, so there is a range of costs. So you're looking at anything from 4 to 6.5 to get you a good idea as to what whitening will cost. Most medical aids do not cover whitening. It makes the biggest difference, absolutely. For, what we do is we do a cleaning as well as a whitening, so that all comes in combination. And usually after just the cleaning appointment, people feel so much better. They look brighter, they feel better, they feel cleaner, and it makes a massive difference if someone can just put a smile on their face. And a lot of times that just from the cleaning, so just the first part of this whitening process gives them absolute confidence.